Let the teacher and me come out for a few seconds. When we talk about NCD, what exactly are we talking about? I think we're talking about a group of diseases that cannot be transmitted from one person to the other. In other words, you cannot really acquire NCD just by sitting beside Kelechi or Professor Anuma. So these are diseases such as cancers, chronic respiratory disorders, cardiovascular disorders, autoimmune disorders, mental problems, quite a host of them. But the thing about them is that I can now catch it when I'm with you. And globally, it is the #1 cause of death. And if I can borrow from Dr. Nkpasanje, in 2016, WHO database indicated that there were 41 million deaths due to NCD, of 57 million people who died all over the world. And that is about 71% of deaths. So all over the world, it is the #1 cause of death. But in Nigeria, it is not the #1 cause of death. The #1 cause of death in Nigeria are still the communicable diseases, deaths from pregnancy and related causes. So those are the ones. So that's why for us, we say we are carrying a double burden of diseases in Nigeria. We still have communicable diseases. We're fighting that war. We've not succeeded. Now we have non-communicable joining it. And when we had trauma and accidents, some people even talk about triple burden of diseases. And that's why, for us, we must take everyone serious. We must take communicable diseases seriously. We must take non-communicable diseases seriously. And then, globally, when we talk about premature death, anybody who dies before age 70 has died prematurely. So anybody here who is less than 70 and dies is a premature death. It's not the 6-week death or 1 year. No. Premature death is anybody dying before age 70, which is also the biblical age. So you must get to 70. You must get to 80, 100, 120, or even 1,000 if it is possible. And so when we try to look at it both sides, globally, when we look at all deaths, the cardiovascular diseases, about a third, 1 out of 3 people all over the world will die from cardiovascular. Cancers will be about 16%. Chronic respiratory disorders, 7%. Diabetes, 3%. And other NCDs, mental problems, autoimmune disorders, osteoarthritis, osteoporosis, will be about 15%. And then globally, the communicable diseases, neonatal disorders, perinatal death, maternal mortality will be 20%, 1 in 5. But when you come to Nigeria, there is a reversal. Don't start my slide. I've not started my slide at all. So you still go back to the beginning of my slide. I started putting this together when people were talking about the statistics. And I thought as a teacher I must correct and put it in the correct perspective. In Nigeria, cardiovascular diseases is 11%, cancers 4%, when you look at what is happening globally. Globally, cardiovascular is 31%, but in Nigeria it is 11%. Cancers globally 16%, in Nigeria it is 4%. Chronic respiratory disorders 7% globally, 2% in Nigeria. But the communicable one globally is 20%, but in Nigeria 63%. But because we are getting older in Nigeria, a few years back, our life expectancy was 45. The last review showed 54.5. The women live a little bit longer than men. Now, God knows why. You women, you are stronger than us. So as we grow older, many of the diseases will start coming on. And that's why this is the time for us as a country to take decisive action. Because if we don't take it now, in 10 years' time, it will be a serious problem for us. because that means the communicable diseases will still be battling with it, and then the non-communicable will then become a major explosion. And that's why we need to work very hard in Nigeria to manage these problems. We can manage hypertension, we can manage diabetes before it destroys the heart and the kidney. We can manage them. For now, we do not have a cure, but we can manage. And when we manage them, we will live beyond 70. And then we can manage cancer. That may be worrisome to many people. How can we manage cancer? Cancer can be managed. 40% of cancers are preventable. 40%. By eating well, by exercising, we can prevent 40% of cancers. And another 40% can be detected early. And the strategy to combat cancer is to treat it early. Once you pick cancer early, whatever that part of the body, we will remove it and you are free. But when we do not detect it, there's a problem. And for us in this part of the world, Africa, Asia, and Latin America, 80% of the cancers come late. And there's nothing we can do. No matter where one decides to travel to, 80% of the cancers is wahala.
So in this meeting, we've had this golden opportunity to bring so many stakeholders, the most important stakeholders in the space, I should say, in the public space in Nigeria, to talk about the non-communicable diseases. This is a first. So many statistics have been mentioned. 71% of all deaths in the premature age are premature. They are premature deaths, 71% of all deaths. And now the NCDs, the non-communicable diseases, have surpassed all the other causes of death in the world. Gradually, Nigeria is inching to a disaster, in the sense that every minute you hear of somebody having a stroke, you hear of somebody dying of complications of diabetes, you hear of somebody dying of cancer. The question is, have we become so desensitized? Have we lost that humanness? Do we just treat these numbers as just mere numbers? Every individual among those numbers we're talking about is either a father, a mother, a son, a daughter, a grandfather, an uncle, or an aunt somewhere. So it is time for us to look at the human angle. When we talk about the cancers, when we talk about diabetes in Nigeria, when we talk about hypertension and stroke, when we talk about sickle cell, we're talking of human beings. We're talking of lives being lost. We're talking of economic loss to the nation. We're talking of increasing burden on the health system in Nigeria. And so the essence of this meeting is to bring multi-sectoral approach, whereby everybody, be it from environment, be it from youth and sports, be it from education, will come together and brainstorm on how to chart a way forward. This is enough. Like the global movement says, beat NCDs, enough. We've had enough of the NCDs, and Nigeria cannot afford to now become the NCD capital of the world. Rising from this meeting, we are hoping that the next step will be a meeting that will be convened by the Minister of Health after collecting inputs from this meeting for the various ministries and other agencies of government and other partners to sign, to actually commit themselves to taking actions. Within this National Multi-Sectoral Action Plan, there are various strategies of implementation. Activities are going to be drawn, annual work plans are going to be drawn, and we're going to be now be able to assess ourselves on an annual basis, or probably even a quarterly basis, as to the progress we are making. At the beginning, there will be lots of need for resource mobilization, for awareness creation and the like. But going forward, we see progress going forward in the next 3 to 4 years in Nigeria in terms of controlling the NCDs.